Well, despite all the ravages and the challenges of the pandemic, there was one of the silver linings of that pandemic is we came to appreciate the potential value of furthering our use of telehealth, where we could have consultations with patients virtually speaking and not always in person. And although medicine is an in-person phenomenon, and obviously when we treat people, we need to examine people, we need to be with them present, but there are opportunities in particular to provide expert opinion. We found that telehealth was one way in which we could do that. Not only so, we could reach patients who historically have not been did not have as clear access to myeloma expertise. Most myeloma patients are treated in the community, and so it is very often difficult for them to have interaction with a myeloma expert. And with the complexity of myeloma, we strongly encourage people to seek an expert opinion from a myeloma physician. And so in a paper that we recently wrote and published together, we looked at one way to overcoming the inequities and the disparities that we see in healthcare of being a greater use of telehealth. Sadly, there have been some policies, even some laws, very often institutional policies, where this has now been prevented across state lines. And we support the notion of having greater access for all. And we think that telehealth is one method by which we can reach more patients. To conclude this subject, I'll give my personal experience. During the pandemic, I was able to provide expert opinion to patients all around the country, in particular in areas where historically they may not have been able to travel to see Dr. Joe, but they were able literally with a phone to have an expert consultation with me. I think we could expand that work by having greater use of telehealth.